Hello, my name is Andrea Ciotti, and I'm a services coordinator here at Multnomah County Intellectual and Developmental Disabilities Services. This recording is for child welfare certified providers for children who are getting the developmental disability payment. Today, we're going to talk about medical management and record keeping. Medical forms that you'll need to keep for your child getting a DD payment are physician orders, a PRN order form, medication administration records, balancing tests, protocols, and a nursing service plan. And we're going to go through each of these forms in this training. So the physician order form looks something like this. It's an authorization by a licensed healthcare provider that needs to be in the individual's file in your home prior to the usage or implementation of any of these following items. So this needs to be ready in your file before you're serving the child. That is all prescription medications, non-prescriptions medications, except over-the-counter topicals, treatments other than basic first aid, therapies and the use of safeguarding equipment such as health and safety related protection, modified or special diets, prescribed adaptive equipment, or aids to physical functioning. You must have any of these following as well: a copy of the authorization in the format of a written order signed by a licensed healthcare provider. So if any of the items on the previous page are needed by the individual, then there needs to be a written order by a licensed healthcare provider for those. You need to have documentation of a telephone order by a licensed healthcare provider with changes that are clearly documented on the MAR, including the name of the person giving the order, the date and the time, and the name of the person receiving the telephone order. So this is for any changes, and they need to be noted on the MAR. A current prescription or label from the manufacturer as specified by the order of a licensed healthcare provider on file with the pharmacy. The next form is the PRN order form. You must keep a MAR for each individual. The MAR, or medication administration record, must be kept for all medications administered by you, the provider, or an alternate caregiver to that individual, including over-the-counter medications and medications ordered by licensed healthcare providers, and administered as needed PRN. It's very important to note that the PRN order must state the specific amount and time frames. For example, there cannot be an order that states take 1 or 2 pills every 4 to 6 hours. This is because the staff administering the medications can't guess what a person may need, and if the individual is nonverbal or an unreliable reporter, they're considered to be unable to effectively communicate what might be needed. So pretty much anytime a medication is given, both a scheduled medication that is listed on the MAR or medical administration record, and any PRNs or as needed medications for that child, there need to be a clear description of timeframes and amount that should be given to that child. The medical administration record, which is talked about more in depth in another training, must include the following information. It must have the name of the person who is in foster care, the name of the individual, the brand or generic name of the medication, which also the prescribed dosage, the frequency and method of administration, a transcription of the printed instructions from the package for topical medications and treatments without an order from a licensed healthcare provider, times and dates of administration or self-administration of the medications, such as 8 a.m., noon, 8 p.m., signature of the person administering the medication or the person monitoring the self-administration of the medication. There are separate rules for self-administration that can be talked about in a different training. A method of administration, an explanation of why a PRN medication was administered. So it should say why the PRN was administered, as well as the result of the administration of the PRN. An explanation of all medication administration or documentation irregularities. If you forget to sign, if the child missed the medication, that needs to be documented on the MAR. It needs to have the date, the initials of the staff member, and an explanation as to why it was missed. Any known allergy or adverse drug reactions and procedures that maintain and protect the person's physical health also need to be written on the medication administration record. This is an example of the medication administration record, and you can see all of the information here, the name of the individual, you can see their address, and you can see this example of medication and dosage, as well as a signature key. You can also see on the bottom of the form the PRN and refused medication notes, which is where you would note if a child missed a medication or refused a medication or a PRN had been given. A balancing test is required for each psychotropic medication that is prescribed. The balancing test form needs to be filled out by the physician, and annually, if that medication is continued to be used, a new balancing test form needs to be filled out by the prescribing physician each year. A provider must present the licensed healthcare provider with a full and clear description of the behavior and symptoms to be addressed, as well as any side effects. There should be one balancing test form for each psychotropic medication used. You cannot list more than one medication on this form. Protocols also need to be kept in the binder for medication administration. Protocols are a set of written instructions that are designed specifically for that person and tells the supporters of that person how to care for specific risks and other medical issues. These support documents feature options to highly personalize them for each person's support needs. A special focus is paid to highlight the person's preferences on how to be supported and what that person does for themselves around the issue. Some more common risks that usually have protocols are aspiration and choking, seizures, constipation, dehydration, pica, unreported pain and illness. There are forms that can be found on the Oregon ISP website that are template forms for each of these, and a template form that you can use for additional risks if needed. These forms also need to be reviewed annually, usually at the time that the individual support plan is being reviewed. The annual review of these forms shows that they are updated for the individual and shows that they are available for staff and caregivers who support this individual, that know how to address known risks and help keep the child safe. This is an example of an aspiration and choking protocol. There are clear instructions on how to fill this form out on the Oregon ISP website. A nursing service plan. So when nursing services are provided for an individual, the provider must coordinate with a registered nurse and the individual's ISP team to ensure that the nursing services being delivered are sufficient to meet the individual's healthcare needs, and to implement individual's nursing service plan or appropriate portions therein as agreed upon by the ISP team and the registered nurse. You can talk to your services coordinator if a child needs to have a nursing service care plan, and the service coordinator can make a referral for that plan. This is on a case-by-case basis and also depends on the individual's needs.